Facebook. Oh, yeah.
That's our new graphic. Okay. All right, here we go. In 3, 2, 1. Hey, welcome everybody. It's time again for another episode of Health Talks with Dr. Trinh. The one show, maybe the only show, that shows you the way to living a healthier life. One talk at a time. With the man who gives talks all the time, Dr. Trinh. Hey, Dr. Trinh, welcome, sir.
Hey, good morning. Good morning. How are you?
You know, I woke up this morning and I had a smile on my face, but now I'm a little concerned. I look at two headlines. I know we're going to talk about yoga and motion and whatnot here this morning, but we've got to wait a little bit for the guest to join us. So in the meantime, I thought we'd do a couple of quick updates. And one of them is, just on a real quick note, a shout out to those in South County like me who are living near a new growing fire up in San Diego Canyon again. There is an evacuation going, the so-called bonfire. You can see the smoke from my house and the fire in the sky that makes us all fearful that this thing's going to get out of control like the last one, given the extremely dry conditions, although it's not super hot today, which should help. But again, I mean, here we're talking about health. Are we going to have unhealthy air again? What does it do to us long-term to breathe smoke like this?
Close the windows, close the doors, turn on your air purifiers. I think at 2 a.m. last night was when we started getting texts on our cell phone about evacuations. Let me take a look at the cell phone I have here.
I just looked at mine this morning.
Yeah, all these evacuation areas here.
Yeah.
It's
and in fact, they're going to do we're on the list. Orange County Talk Radio, OC Talk Radio is on the emergency list for all the communications, and they just sent me one moments ago. They're going to give an update this morning on this new fire that is so far zero contained. Hasn't spread very far, but it's up in San Diego Canyon on the eastern edge, right at the foothills there as it goes up into the Cleveland National Forest, not far from where I live here in Rancho Santa Margarita. And all of a sudden you can see it in the sky again here.
I heard it was a house fire that started everything.
I know nothing about it. All I know is that this so-called bonfire, I don't know why it's called that, is got everybody scared again that it's going to whip out of control this morning. And we're going to have another week filled with smoke. What does it do health-wise to breathe in smoke like that for a week? Is there any damage? Who's at risk?
Well, I can tell you that the studies show that those who live, and good thing fires is intermittent and not like a daily thing, but those who live in areas of high pollution, aka breathing in smog, fire, blah blah blah, is at higher risk for Alzheimer's than those who live in areas of lower
really
pollution.
Alzheimer's. I would think lung cancer and other sorts of things, obviously with your lungs breathing in.
I'm sure there's data on that as well, but I saw the data specifically for Alzheimer's, but very scary that this is happening every time there is wind or extreme heat. It's like we can automatically expect a fire. That's kind of scary.
Yeah, and now we're coming to, except I had to look up this morning. I typed in my address. I'm part of PG&E. I'm part of that northern boundary of Pacific Gas and Electric Company's electric service, a little bit of South Orange County. Most of it's in SoCal or Southern California Edison, but I happen to be in PG&E, and so you can go to their website and see they were threatening to shut off the power again last night or this morning.
Really?
To turn the power lines off so that they don't spark something and cause some fire. But as of this morning, as of 10 minutes ago, I'm still safe, so this broadcast should continue here. But if suddenly we fizz out, you'll know what happened. They shut the power off. I mean, the crazy things we're living through now. We might have the power shut off. Every time there is a spike in the winds, seems like a fire whips up as well. things we would have thought were inconceivable even last year now are part of the new normal or our new considerations here.
Right, right. And so anyway, yeah, my recommendation is to close everything, try not to breathe the stuff in.
Yeah.
And
just hold your breath all day.
Hold your breath all day, and hopefully they'll get this under control really quick.
All right, so the next one is that's one fear this morning, a very fear close to all of us here in South Orange County. Second one is, can I be reading this right? That according to what I saw on Google News, let me pull it up again here, more than 2,800 COVID deaths were reported yesterday in the United States. That's a record. It's a single-day record. 2,800 people die.
Where is that from? What link is that?
This is CNN was on here. It says on CNN, it says the U.S. has reported its highest one-day COVID-19 death tally, over 2,800 people. And the doctor who's quoted in here says, expect this to go up in the next few weeks, where we could get basically a 9/11 style loss every day. The same number of people that died in the horrible 9/11 attack that shocked, horrified, paralyzed, frightened all of us is now everyday occurrence. 2,800 people die every day, and we go, as long as it's not me, it's not so bad. I don't think it's really that bad. Does any of this ever reach a tipping point? Does any of this ever reach I don't know.
It's quite scary, actually, to consider that. I've been tracking the ICU beds available in Orange County.
Yeah, tell us. Because before you tell me that, the rest of the article says the number of COVID-19 patients in U.S. hospitals also reached an all-time record. 100,226 people are in hospital beds right now because of COVID.
Right. And so the bed availability is shrinking every day. In Orange County, we have close to 700 ICU beds.
Okay.
And the reason I track ICU beds is because if those ICU beds run out and a patient needs intubation or ICU care, that's when we are in trouble, because if we don't have that availability, that's when we start to see the death rate climb even
well, because
higher.
then we're doing what they did in Italy and what everybody was so afraid of in the spring. We're having to choose who lives and who dies. We're saying that we know we could save you, but we don't have the breathing tubes, we don't have the bed, or we don't have the staff to attend to you. So good luck, go home, Godspeed, hope you make it.
Yes.
And it also leads to then a trickle-down effect. Maybe it's not a trickle, maybe it's a flood, where other people who would normally be taking up those ICU beds, heart attacks, strokes, car accidents, other sorts of things that need critical care, can't, because we've got Joe over here sitting there saving him from COVID here.
Exactly. And I've been telling folks that, yes, the case numbers are much higher, and we see that. And that is concerning. What's the measure that I look at as far as what concerns me is bed availability.
Yeah.
We just don't want our health system to be overwhelmed where we cannot take care of other patients who don't have COVID, our heart attack patients, our stroke patients, our patients who are in for cancer treatments and things of that sort. And that seemed to be everybody. A couple of people asked me, not everybody, but a couple of people asked me back in the spring, what do you think? You're sitting at the command post here. You're listening to yes and no. You're listening to you're on the public health calls from the county and elsewhere. And everybody asked me the same thing. What do you think? I said, I think it's I said, this may be wrong, but I said, I think most people will live through COVID. It may be miserable. And if you're of a certain age or a certain affliction, you may need a special care to make it through.
And I said, but the fear is that we won't have enough beds, masks, intubators, air breathing machines to save everybody. And I said, that's what they're afraid of. That's why they're shutting this whole thing down, because they just want to kind of get a grasp on what we've got here. Most people can be saved, but that might mean extraordinary efforts that may or may not be available if the system gets overwhelmed.
Yes, it's more about overwhelming the system. And because once the system gets overwhelmed, once the doctors and nurses get burnt out, you'll be in trouble.
Or sick, burned out or sick, or just give up, or a suicide. The suicide rate among hospital, I still can't wrap my head around that. People are just getting overwhelmed and depressed and saying, I can't handle it, or boom, and I'm going to end my life because I can't handle this overwhelming tragedy.
I was chatting with a friend yesterday, and her husband is a teacher.
Right.
And she had mentioned from her husband that they have seen during this time of COVID, they have seen at least 9 to 10 suicide attempts among students.
What? I mean, that's just, does anybody but me find that just shocking? That,
yeah.
I'm my old Midwest upbringing, just buck up, hunker down. I know it's tough, but, bite the bullet and be tough. Maybe we're just not used to this. Maybe as a society we need to toughen up, or maybe I'm just talking like my old father, and that was always there. Times were tough and people, can't handle it even then.
So this pandemic isn't just about the virus. This pandemic deals with many other health issues that is contributed by the virus, that is contributed by being shut down, that's
right.
contributed by things being closed, obviously with not just jobs and the economy, but really other health issues as well. Loneliness, I heard yesterday. I've been seeing on Facebook folks just posting saying, they're fed up because of the loneliness that they've had.
Yeah.
So, man, it is hard to.
Do you think there will be a I almost want to call it a post-traumatic stress disorder?
Yeah.
Where I remember I always use this example. My wife was in a rather serious car crash years ago, and when she called me immediately after in the car, she's still in the car waiting for AAA and the police to come. She got T-boned at an intersection, and the car spun around. And my first question, are you okay? And she says, I think so. And it wasn't until weeks later she started getting her neck hurt, other sorts of things hurt. And she was like, why then? She said, because your body kicks in immediately and the adrenaline kicks in, and you think, I'm okay. And then you notice, oh my God, I'm bleeding, or oh my God, my arm's broken here. You didn't even notice it inside. That's post-traumatic. The stress, there is a something that kicks in when you finally relax and take stock of yourself, and you say, wait a minute, I'm not feeling as good as I thought I did.
Yes, exactly. I'm doing a Zoom chat tomorrow, and it's about mental health and brain health post-COVID.
Yeah.
We are seeing a lot of folks who are complaining that their coronavirus has gone away, but they still have their brain fog.
Yes.
Or their coronavirus have gone away, but they've lost a lot of hair for some reason, and they're still losing
They've lost hair. Wow.
Mm-hmm. I've seen a few patients mention that, or a few folks mention that already. Or memory loss problems have increased as a result of coronavirus infections. And we're going to do a little talk about that tomorrow on Zoom. It's must be a popular topic. We have over 100 RSVPs to the chat already.
Wow. Well, again, we're going to talk today on something very specific to that. Everybody keeps saying, "Who's the guest?" We're vamping here, as they say.
Paula James.
Paula James. And why don't you identify Paula James, what we're going to talk about today, because it's directly related to that stress and how do you handle it?
Yes. Paula James is her name, but
and what does she do?
So she teaches about movement and she teaches movement and health. So she teaches on Zoom.
So it's like yoga and what? And she had some catchy title. What was you just read it somewhere here? The art of movement or something during stressful time.
The art of movement. I think she's got a website. We'll ask her when she comes on. She should be coming on in a few minutes here with that. Good morning, Dan.
So the idea is how you deal with stress, and that seems to be the topic nobody wants to talk about. We're all talking about the overwhelmed hospital care system. That the good news is, particularly now that we seem to have a better handle on it, they seem to have better ways to treat. They have better regimens. They have better techniques. They have better drugs, maybe, whatever. The mortality rate has dropped. Has it dropped a lot or a little? It seems like for a while they thought this was going to have a higher mortality rate, 10 times the flu.
It has dropped. I believe after you add in all the asymptomatic COVID patients and very mildly symptomatic COVID patients, the mortality rate will be under 1%. Okay. What that means is 99% of us will survive, all right? 99 plus, which is a great, I mean, nothing's ever great with mortality.
Right.
But the fact that over 99% of patients will survive is a good thing. The question is, if you survive, are you going to have prolonged symptoms like brain fog, like, the loss of taste and smell? Does it come back? The chronic fatigue, which I'm hearing about a lot.
Right.
So how are you going to be after you survive is the next question. Are you going to go back and be 100% fine? Maybe you will if you're young and healthy. But what if you're not young and healthy? Will you have chronic symptoms post-COVID is the concern.
And that goes to the heart of what I've heard people actually say this, young people particularly. Hey, let's go have a super spreader event. 99% of us are going to live. Let's all get sick and get it over with, and then we'll just build up the antibodies and we'll go on. Let's just like my parents did. I'm horrified to say, when I was a kid with measles, they gathered us all together in the neighborhood and they infected all of us.
Yes. That was the herd mentality of herd immunity. Let's just get it over with. Let me get my immunity and things of that sort. So that may work with measles. The question is it going to work with COVID? Nobody knows yet. It's such a new virus that, you can't do this with the flu, right?
Right.
You can't say, well, let me just catch the flu so that I'll never worry about the flu again.
Right.
That doesn't work, does it?
No. Well, and again, there's two fallacies to that let's just get it over argument. One is we don't know what the long-term side effects, and there seem to be some disturbing anecdotal evidence. No studies yet, but you seeing it, people are reporting it, brain fog, chronic fatigue, other sorts of depression setting in, maybe just because you're sick and you're tired, but there are post-traumatic, after the fact, lingering symptoms that may be worrisome, that maybe you don't want to get, even if you just want to get it over. And the other problem is, you get really sick. This isn't like the flu where many people can just keep on supposedly working, but others, you're devastated. You got to go to the hospital. You got to get intubated. I always want to say incubated. You got to get intubated. You got to get a tube inside of you. And it's pretty stressful and it's pretty severe. And do you really want to go through this?
Right. And so, so Dan Daly says COVID has increased stress levels beyond one's imagination.
Yeah.
Absolutely, Dan. I hope you're staying safe where you're at with the fires now.
So let me ask everybody the question. I love to ask questions and get some feedback because I really share this with our community and with others. I might say, we did this show and I can't believe it. Here's what people said. So here's the question to the community this morning here, while we're waiting for our stress guest to come on and teach us how to stay calm through yoga and other things. Did you self-isolate, stay home for Thanksgiving? Did you have a small gathering, immediate friends and family, 4, 5, 6 people, or did you just say the heck with it and go to your regular Thanksgiving? What did you do in Thanksgiving? I will start the ball rolling and saying, I wanted to cancel Thanksgiving. And of course, my family said, no, come on, you're just being, difficult. And so we had a small Thanksgiving. There were probably my daughter and son-in-law, his mother and sister, and 2 friends. So it was a small event, but it wasn't, and I don't know what his friends do. I don't know what his mother does. She lives over in Santa Ana. That's a hot spot. So I was the ugly one in the room. I wore a mask all day, and everybody's like, oh, take that off. I'm like, no, I'm going to sit here I don't know these other people. I don't know what they're doing. I've been seeing my son-in-law and daughter and my grandchildren throughout. So I kind of feel safe with that. But these other strangers, I'm going to wear a mask in the day. And everybody thought I was nuts.
Our guest is in the waiting room now.
She is. Okay. Yes. Well, while we're getting the guest on, answer that question. If you would type in, what'd you do for Thanksgiving? Nothing?
What did you guys do for Thanksgiving? Dan, what did you do for Thanksgiving?
Yeah. Did you do anything? Did you do something? Did you stay home? Did you do something different? Or did you say the heck with it? While we're getting that answer in there, let's bring in Kim Thompson. Is it Kim Thompson?
That's her.
Says Kim Thompson. Welcome, Kim Thompson. We thought we were looking for a different name here.
Okay.
Paula or
Morning.
Paula?
We'll go with Kim today.
All right, Kim. It's just you're just flexible. Next week it might be Tony. Next week it might be Susie.
How are you today?
Good. Identify yourself for our guests here and give us your quick bio. Who are you and what are we going to talk about today?
I'm Kim Thompson. I teach movement classes. I help people learn how to move a little bit more comfortably and especially how to remain safely active as they age.
Ah, okay.
Ooh, tell us more.
Yeah, tell us more, because we're all of a certain age, most of us, and we're all. I was just reading yesterday in my little Google News feed a little positive article that said, if you just exercise 11 minutes a day, I always thought it was 20 or 30 minutes a day. They're saying just give me 10 minutes a day, 11 minutes a day. You'll extend your life. Does any bit help? Does 5 minutes help? Does 2 minutes help?
You know what I'm interested in more is not how many minutes or what are you doing, but how are you doing it? So let me give you this.
So just going like this for 10 minutes doesn't necessarily get it done here. All right.
So can you see this? Through the camera here, we've got a tensegrity model.
A what? What a model? A 10?
Tensegrity. So there are sticks and thread that are, so the sticks are spacers, and as an analogy with your body, they're like the bones.
Okay.
And then the thread is like your soft tissue, your muscle and ligaments. And when the bones are spaced evenly, then you'll get movement that happens coherently through the whole structure. And also balance will be pretty good. This structure will be able to balance on 3 points. And in terms of yoga, I'll be able to switch it to any 3 points, right? I can stand on one foot, I can stand on the other foot, I can do an arm balance, I'm good.
What a clever, I never heard of what did you call this again? A tensegrity? Tensegrity,
Now this one is not as well tuned.
No.
And so the spacing is not as even. And you'll notice as I move sticks that you don't have quite the same coherent, organized movement happening within. And if I try to stand this one on 3 points, what you'll notice is that it can't do it.
Falls.
And so, in fact, balance might be more related to how are you distributing length among your soft tissues than strength or inner ear or all of that. So what do I mean by length? Your muscles work in teams around a joint. And
you got to go slowly with this here. I know this is.
Right?
I'm going to get you to slow down a little bit here. So let's stop for 1 second and just take in what you said. All right. So if the body is, I love the tuning analogy. That makes it look like an instrument. If I tune the guitar, if I tune the strings properly and maintain the right tension, then the body I can flip it around any which way it wants, and it moves coordinated, and it won't fall over. if
You'll
I
have some coherence and integrity. And I love what you're saying, because if you've ever played a musical instrument
Yeah.
that is wood and strings, you
Right.
know that anytime the temperature or humidity change,
right,
you need to tune it.
right, exactly,
It
because
doesn't
the
matter
strings,
how good you are. If you have an out-of-tune instrument, you cannot play something that sounds pleasing.
exactly,
And
and
if you
so
have an out-of-tune instrument, you don't need a new instrument or an upgrade. You just need to tune the one that you have.
I love it. See, that's the analogy I was going for. When the minute you said that, you got strings, you've got this wooden structure with strings on it. We're kind of a not wooden structure. We're not little puppets, but we have these bones that are kind of like wooden structure. And the strings, you're saying, that attach the bones are the ligaments around the joints, right?
The ligaments and the muscles.
All right. So if we tune those and keep those, what does tuning them mean? Keeping them strong, keeping them spaced, keeping them tense. What is tuning?
Adjusting the length.
The
So
length.